Diagnosis live from the clinic. To get an appointment tonight, go online. I'm Dr. Christian.
And I'm Dr. Dawn, and our first patient is ready.
Right, oh, right.
The Skype camera for us?
Yeah.
OK. Whilst you're doing that, just talk me through. So how did the wound happen in the first place?
I got...
No, that's not right, is it?
Absolutely
that's not right.
No.
But in my mind, there are 3 reasons why a wound doesn't. Maybe it's that the blood supply aren't getting there, and maybe...
No, actually.
Take a seat down again, love, before you. Make yourself comfortable.
Andy, be very honest with me now.
A leg of a chair went...
Chronic infection. Get your GP to swab it. Shall we have a look? So we can see what you mean?
Yeah.
If you're injecting in your tummy, you can get dystrophy and you get these kind of fatty little lumps. And I just wonder whether that might, spot-reducing fatty lumps, unfortunately, is really difficult.
I mean, it's a question. It's only a very small area, and having a bit of lipo on that area from a good practitioner actually may make...
You're in the right place, OK? Because Dr. Christian's a bit of an expert on sexual health, so we'll be right back with you in just a few minutes. We will go to the website.
Now it's back to Paul. So, Paul, you've just announced that you've...
Yeah, and that's what it's called. I'm a type 1 diabetic.
Are you? So you're injecting insulin as well? 1 or 2 sessions of cream? I'm talking maybe 3. They do, I'm afraid, yeah. There's a few skin conditions that do.
Say this time and time again, but if you're sexually active, you do need regular screenings. And you can make your own appointment at a sexual health clinic without a referral from your GP. And if you don't want to bump into someone you know, you can go out of area.
It does happen.
Go to our website to find out more.
You don't always need to see a doctor. We spend £2.4 billion on over-the-counter blister packs and bottles a year. And Pixie's going to make sure you're making the best consumer. Pollen count is going to be low, like it is today, so we can all go out and enjoy the sunshine. Across the series, we'll be testing other over-the-counter products. So if you've got persistent piles, thrush or athlete's foot and you want to be involved, then go to channel4.com/clinic. Well, we've got another patient. Sounds like Dawn's area, if you know what I mean.
The natural acidity, and our vaginas are naturally slightly acidic, change.
Right.
That's such a natural reaction, but you're probably that maybe it's a sexually transmitted infection, maybe they've got a new partner and they've had a flare-up and it's not...
20,000 laser eye operations taking place in the UK every year. It's clearly becoming much more popular, but remember, it may not be suitable for everyone.
So it's really important to get the right advice and find a good specialist. Just remember, when it comes to healthcare, the cheapest isn't always the wisest.
Definitely not. Get told of potential complications and really don't be frightened to ask what could go wrong. It's important.
And don't forget, if you've got any other questions about your health, go to our website or tweet us. We're fully booked for tonight's clinic, but we're still taking appointments for next week and beyond. And next up to see us is Emma. Hold that, we'll be with you in just a few minutes. And we'll be able to help you out, I'm sure.
Skin can cause problems for all, especially as we're approaching summer and we start bearing it a little bit more.
As doctors, skin problems are some of the commonest things that walk into our surgeries, and this clinic is no different. And someone who understands over the last month is pregnancy according... Okay.
Off the crusting. It's not like a discharge, it's all the time.
Painful, Emma, was that... That sounds
It was
horrible.
painful.
Getting a bit more information is to do a biopsy, so actually get a little bit. It's not... Well, really, ask your GP for a referral back to a dermatologist for a biopsy. Is that the best thing?
Exactly.
Yeah.
OK.
Well, the good news is we have actually got Pixie available to us on Skype about the result, weren't you? Quite understandably. We have got people queuing up to come and visit us in the clinic, and we've got a guy who's just come through now. It's Ben. And can we have a look? Is it easy to see? That's something that we call a halo mole, but we have the expert here. So, Dr. Chopra, tell us, does he need to be worried?
In its own right, a halo...
Right, to get somebody to take a look at it, because I think we do that a lot. We say to patients, right, if it changes colour, if it changes...
Really good example of where sort of modern technologies like Skyping your GP, you don't...
happen because often there's a specific trigger for psoriasis. I think that is one of the most common things that I have heard is the time-consuming nature.
Are they visible as well?
You need something a little bit more, and I think often people are a bit frightened of taking steroid creams because they've heard all these scare stories. If you don't come back and see me, I assume you're better, all right? I'm not that uncommon, actually, I think.
I certainly know Dawn has made a few of those in her time, that's for sure.
I'll speak to him later.
Sorry, Dawn.
I shall speak to you later. Do you know what? So, if you've got a skin worry and you want to get it checked out, then go and make an appointment to your GP. But if you want to speak to someone tonight, then Dr. Pixie and Dr. Chopra are available for a web chat straight after the show.
See you then. This is live from the clinic where you get to lie on your own couch as opposed to ours. And our next patient is ready. Hi there.
Interesting. Our testers thought that cetirizine was the best because they thought it was the easiest to use and the fastest working.
Yeah, absolutely. But remember that you can actually buy generic versions or pharmacies' own brands of the medicines. It's the same drug, but it might actually be a lot cheaper. Do you know what? I am so sympathetic of these people because I get terrible hay fever. And even as a doctor, I don't treat it right. I wait till I've got the itchy eyes and the sneezing, and then I go, oh, I better pop a pill.
And if you do it as a doctor, you ought to know better.
Absolutely.
You can bet your bottom dollar that so do most people, actually.
I think they do. I mean, treating it is the key. You need to treat regularly, and you need to treat before the symptoms start.
And also, though, I think we are all guilty sometimes of forgetting the other things. It's not just the treatment, is it? You know, it's the wraparound sunglasses, it's the staying in, it's, you know, the washing your clothes, not hanging them out on the line.
Do you know what? It's a
Vaseline on your
nuisance.
nose.
It's a real nuisance is what hay fever is, and I'm sympathetic.
Could be a cold sore, a herpes virus. Okay. About it
Adele, I'm going to stop you because your sound is getting us real...
is if you've got the Zovirax, the Activir tablets from your...
Then that might be your best option.
You're
And it's not just the Klinefelters necessarily that's giving this problem. Your body is trim as you can.
I'll tell you what we'll do, actually. You stay on the line and we'll have a little chat with you again in a few moments, all right? Because obviously that's something that's bothering you quite a lot, OK?